All right, guys, welcome back to our 100 days fitness blueprint. Today is day 81, and we'll be looking at common fitness injuries and how to avoid them. Common fitness injuries and how to avoid them. Number one is muscle strain or strain rather. Now, what is strain? Strain is the overuse or sudden injury to your muscles or your tendons. Is the overuse or sudden injuries to your muscles or your tendon. That's what strain means. Two, joint sprain. Now, okay, let me just, you might have heard of sprain and strain. Then the second is strain, twisting or overstretching of what? Of ligaments. Why strain has to do with overstretching of muscles and tendons. Sprain has to do with overstretching of ligaments. Overstretching of ligaments. Now, your ligaments, they are elastic in nature. However, there is a limit they are supposed to be stretched to. However, when you overstretch them beyond a particular limit, can actually what? Can actually cause injury. So, sprain is an example of injury that when you overstretch the ligament, it can actually what? Happen. Then the next is shin splints. Pain, this kind of pain are the pain that happen along the shin bone, and it's usually caused by either overuse or it caused by overstress. You know where shin is. When we use the word for football, we say shin guard. So that's where your shin splint, any pain that occur along there is what is caused as a result of overuse or stress. Then the next is tendinitis. Tendinitis is usually an inflammation of the tendon due to overuse or repetitive movement. Now, tendons are okay. So, like we were saying to now before that interruption, we're saying that tendinitis, as the name implies, injuries associated with the tendon, and is usually due to overuse of the tendons or repetitive movements. This can usually be caused either overtraining. Yes, overtraining can actually lead to this. Now, when we say tendons, these are tissues that attach bones to muscles. These are what we refer to as tendons. Then when we talk about ligaments, we're talking about tissues that attach bones to one bone to another at a joint. So that's the little difference between the two of them. So one attach muscles to bone while the other attach bone to bone. Tendon attach muscles to bone while ligaments attach bone to bone at a joint. So that's the the quickest of definition you can actually give to the two of them. Then stress fracture. These are tiny cracks that actually happen in your bone that are usually caused as a result of you overusing those particular bone or those set of bone. These can actually happen. Now, to actually prevent all of this, proper warm-up and proper cool-down is very necessary in avoiding, is the easiest way you can actually avoid any of all this. Then two, solution to avoiding injuries during workout is proper form. Focusing on proper body form, we cannot emphasize on that enough. Focus on proper body form and technique throughout your workout to avoid putting unnecessary stress on your body. When you do not focus on using proper body form to do any program, it will put unnecessary stress on your body, and this can actually cause injury. Then progressive overload. Now, if you do not focus on progressive overload, you just want to jump to the next weight unnecessarily. Meanwhile, your body has not what actually adapted to the one you're actually using at the moment. There's a likely tendency of what of injury happening, and you know this is bad. So focus on progressive overload. Then rest and recovery. Rest and recovery. Take rest days, either one or twice in a week, is what is a good for what for proper body recovery and body repair. The next thing, though, one of the ways that can actually another way to avoid injury in your training is vary your workout to avoid overuse, injuries, as well as promote overall fitness. Now, when you cross train, it means that when you train a particular group of muscles today, if you are training again tomorrow, it should be a different group of muscles. If you are training the third day, it should be another group of muscles entirely. So this will actually what help you why the other parts that you earlier worked on, the earlier muscles that you actually worked on, why they will be recovering, you'll be using other ones for other workout. And also do well to listen to your body and know when to stop if you experience any sign of injury. So these are some of the ways you can actually avoid injuries in workout. Then some few additional tips is good posture. Body form and posture, they actually work side by side, so you cannot remove one from the other. Then good clothing and proper footwear is actually very important when it comes to fitness. Yes, especially programs that has to do with you standing or you walking or running. They are very what they have your shoe is very will play your footwear rather will play a critical role in you preventing injury in your workout. Then the last but not the least is okay. Let me just say this is second to the last. Stay hydrated. Drink plenty of water before, during, and after workout. The reason is this: when you work out, you lose fluid. And apart from the fact that when you work out, you lose fluid, in your daily activity, you performing your daily activity alone, you lose fluid. As I'm talking to you now, I'm losing fluid. You understand? So that's the reason why you must stay hydrated as often as possible. Then the last, address any underlying conditions. If you have any existing medical conditions, you can consult your doctor. Now, when we do assessment for there's what we call physical activity readiness questionnaire that I usually administer as a trainer for people who are starting, who are enrolling in our gym new. Now, when you are registering in our gym new or you are enrolling for a fitness program in our gym, either me or any of my colleagues, that's one of the things that we ought, after taking your information and the next, you fill that physical activity readiness questionnaire. So this is what we use to assess you to know if the way this questionnaire is actually designed is designed to know if you have, any underlying health medical conditions. No health condition is actually there, but the way the questionnaire is designed, it will trigger you to, if you have, you tick it unknowingly. And when you do that, we'll refer you to the hospital that is attached to our laboratory. We have a hospital attached to our fitness center, so we easily send you there with a medical clearance form. So we send you to our sports medicine, our doctor who specializes in sports medicine. So you go to him or her, he gives you a medical clearance, should administer on you, and the ones that we should not actually administer, depending on or based on your health condition. After him also doing his own assessment, then he brings that medical clearance form. Then this will will determine the kind of exercise we actually restrict you from doing, as well as the ones we will give to you. So tell me, have you ever had any injury, and how were you able to recover from